What does the CFTR protein do in CF sweat glands? Imagine your body as a busy factory with many tiny workers doing important jobs. One of these workers is the CFTR protein, which acts like a gatekeeper for chloride ions in sweat glands. Its main job is to control how chloride ions move in and out of the cells lining the sweat duct. When sweat is produced, it starts out as a salty, watery fluid full of sodium chloride. As it travels through the sweat duct, the CFTR channels open up to allow chloride ions to be reabsorbed back into the cells. Sodium ions then follow passively to keep everything balanced electrically. This process helps reduce the salt content in the sweat that finally reaches your skin's surface. In healthy sweat glands, this chloride reabsorption is smooth and efficient. The CFTR protein ensures that sodium and chloride are reclaimed, making the sweat less salty. This is important because it helps maintain the body's salt and water balance. When the sweat reaches the skin, it is less salty, which is normal and expected. Now, in cystic fibrosis, the story changes. Mutations in the CFTR gene cause the protein to be defective, missing, or not working properly. Without a functioning CFTR channel, chloride ions can't be reabsorbed from the sweat duct. Since chloride reabsorption is blocked, sodium ions also stay in the sweat because the electrical gradient needed to pull sodium back is lost. As a result, the sweat becomes abnormally salty, often 3 to 5 times saltier than normal. This salty sweat is a hallmark sign of cystic fibrosis and is often used as a diagnostic clue. While the salty sweat itself isn't usually dangerous, it can lead to problems if a person loses too much salt, especially in hot weather or during heavy exercise. Excess salt loss can cause dehydration and electrolyte imbalances, which may lead to symptoms like dizziness, weakness, or cramps if not managed properly. In summary, the CFTR protein in sweat glands acts as a chloride channel that helps reabsorb salt from sweat. When it works correctly, it keeps sweat salty but not excessively so. When it doesn't, salt stays in the sweat, leading to the characteristic high salt content seen in cystic fibrosis. This abnormal salt reabsorption impacts not just sweat but also the body's overall salt and water balance, which is why managing hydration and electrolyte levels is important for people with cystic fibrosis. Always remember, if you have concerns about cystic fibrosis or sweat gland function, consult healthcare professionals for personalized advice and testing.